Opportunity to ask Mr. Theep Cherion, co-founder of Perfect Relations, to come up on stage. He's going to have a very interesting conversation with Dr. B. Basar Raal, who's the founder of KIMS Hospital. So if I can have you on stage. Mr. Cherion and Dr. Rao. Round of applause, please.
Thank you. Health, hospitals, hope. If one looks at what every person in this hall, in the audience is looking at, it is the hope that they stay healthy and don't need to go to a hospital. Is that the future of hospitals? Or should hospitals be, doctor, a place where you go to reassert your healthiness and to look at perhaps issues like longevity or enhancement of certain things. I don't mean cosmetic enhancements, but enhancements of various other things. Do you see the next generation of hospitals being places of the kind where you go because one of the many rings I wear tells me that you need to look at this parameter and go and get this checked
out? Thanks for inviting me this and associate, and I congratulate Mr. Kartikeya Sharma as organizing this type of event. A very good question, and first of all, let me see what is health. Many people think ill health is good health, which is not so. The health is a complete emotional, physical, social well-being is the what we define as a health. So most of the people don't give importance on all those things. How do you get all these three important things? One, you have a good diet, which no one able to respect that. The second one is physical fitness, good exercise. Not many people do that. Third one is a good sleep of at least 7 hours in a day. That will able to take care of, keep you fit. And as you mentioned that they will be keep away from the hospitals. If these three follows, but we keep on telling to all our patients, whoever comes to the hospital, but nobody will able to follow that. They won't even listen, they hear and they don't follow. That's why the hospitals are requiring more and more.
You're very right, Doc, because I woke up this morning after too little sleep because I had to finish a meeting before I came for the Prime Minister's session. In the delightful lounge for speakers, I ate 2 croissants and 2 samosas. So guilty as charged on all this. Now, as a hospital, one way of looking at the market for hospitals is to say that chronic illnesses and illnesses of the kind which are long-term, diabetes, blood pressure, etc., are one source of business for a hospital. But when will hospitals begin to be, if one takes the proportion, when will we start looking at all the things which you said, emotional health? For example, I don't see at any time I go in, I don't see any doctor sitting me down and giving me either, hopefully not medication, but at least medically sound advice on sleep, unless you have a problem. Okay? So, is intervention something that happens, Dr. Rao, too late, or Is that one of the weaknesses, or is it built into the structure of hospitals?
So usually the health, when we come to the hospitals, we need to take care of three important aspects. One is the preventive health, the other one is the curative health, third one is the rehabilitation. And later on we are getting, when the aging is coming, the palliative care and the end of life care and also the geriatric care. So far, honestly, all the hospitals are concentrating only on the curative aspect. Now, we need to be able to build, if we want to give a good quality of life, whoever comes to the hospital, they should live a quality of life. We need to be able to propagate. Prevention, anyhow, I already said, even we keep on saying the lot of digital media and everything, but we don't listen, because when we do all those things, what is the purpose of life? We need to enjoy. That is the concept people are thinking. So now the quality of life will come. We need to build the rehabilitation, where many of the people suffers with accidents, or it may be brain surgeries, or maybe physical things. We need to be able to make them back with a good quality of life. We have seen now a 70-year-old person lives on her own or his own life, even if he met an accident or he has developed a paralysis. So that is the thing which are building up. And we also should give equally importance to the end of life. Many people struggles to keep on putting, even though there is no hope conveyed by the doctors, but the patients, the patient attenders are still not accepting that end of life. That also we need to be able to build. Now most of the population is coming around crossing more than 70, then we also need to build a geriatric care.
Dr. Rao, I'm going to ask a question which is a bit future oriented, but we have in the audience a gentleman who used to be our Minister for Railways, and there was a question. He had a problem with the officials who said, we can't give data on where the trains are parked. Similarly, hospitals have an issue of privacy of data. And the fact is that all the devices that we wear gather data. We are all quantified in some form or the other. But how do you ensure privacy and yet ensure that the data can be processed in such a way that hospitals like you can give an early alert that a train, or in this case, an artery, is blocked at this point and you need to take a look at it?
No, there is no privacy or anything as far as the data is concerned, as long as it is the patient's personal things. There is a lot more on the public domain today. The entire artificial intelligence has come. There are millions of X-rays they will be able to screen. And now they are saying that this is going to be easy to identify this is the correct disease, like pathology, the X-rays, radiology, CT scans and all. And also we are taking about the Ayushman Bharat, all the state government schemes. The entire data is available with them. We are only uploading on a daily basis. This data is going to help and also create with an artificial intelligence that we can able to predict. Even there are so many gadgets are coming, we are going to predict when the diabetes is going to come, when the hypertension is going to come, when the brain stroke is going to come. So all these things, we are using this data and trying to predict a bit earlier than, rather than we are now treating once the disease comes to us. It is available already.
So in a sense, looking a little further into the future, is it possible, therefore, that hospitals will be specialist centers where you come in to get, as it were, a diagnosis of what's going to happen to you in the next 3 years? Is that the next phase as far as hospitals like yours are concerned? How far away do you see that happening?
It's not very far, but now many of the people are going to look into that. There is now some gadgets are also available where you can able to just predict by the temperature of the forehead or the fingers, where what are the diseases that you are going to face and when the heart disease is going to come. I think it is very, very near future that we can able to purely predict and identify the diseases which you are going to face.
What is the India advantage? Does India have because of the large number of people who are old and the very large number of people who are young, do you think India could be a kind of powerhouse in understanding and providing the base level of technology where these things can be then built upon? Is this an advantage?
Yes. In India, because the population, both young and middle and the elderly people are there, equal number, and we have a lot more clinical trials and other things or research is going on. So with this, I think we will be the powerhouse, definitely can able to build and identify, and we can able to tell. If you look into that in India, when I was a medical student at the 4 decades back, lot of Indians used to go to America and UK and other countries to get the treatment, even including a bypass surgery. Today it is reverse. There are so many flights which are coming from the entire world to India to get the treatment done. One, the quality. The second one is the less expensive when compared to their own countries. Even including the American and Europe, the Indian population, they are specifically coming here to get the treatments. That's why we have been built the Indian healthcare in a much advanced. For example, if you want to get it done a CT scan or MRI in America, it takes about 3-4 weeks. In UK, it will take about 5-6 weeks. But here we can able to do it in half an hour. But for that also, our people doesn't have the patience to wait for half an hour in India. That is the scenario. So definitely in healthcare, India is going to lead in all aspects of the prevention, the curative, and also the digital, the artificial intelligence, because of the volume what we have seen. Even today, our young population are getting heart diseases, which was never heard in before. Nearly 20% of the people who are less than 40 years, they are getting because of the advancements that are coming in the technology, the IT, and the people are stressful, not able to understand the proper health. We now, with you are promoting yoga and all those things, apart from doing things, we should also concentrate little bit. A lot of people are changing towards the prevention of health. If it continues, then it will be definitely a good thing for India.
Thank you, Dr. Rao. This is a theme which the Prime Minister dwelt on this morning. Tourism, health tourism, etc. So thank you very much. Great pleasure. And thank you all for being such a wonderful audience.
Thank you very much.
Thank you.
Mr. Cherion, thank you so much for that wonderful conversation. Ladies and gentlemen, now it's time for us to hear a powerful message on what is next in power. Please join me in welcoming the Honorable I beg your pardon. Please join me in welcoming the Honorable Union Minister for Housing and Urban Affairs of Bharat, Shri Manohar Lal. A big round of applause, please. Shri Manohar Lal will be with us in just a second. He's going to be addressing all of you, and we are going to, in fact, hear from him on what is next in power, what is next in politics, and his plans for his department.